the first thing I'm going to do is knock knock. Hi, my name is Ellie. I'm a student nurse from St. Martin's. Can you tell me your name and your date of birth? And I'm going to double check it with the wristband. All right, perfect. As I come in, I want to assess partner support, if the partner's in the room holding the baby, how the mother is interacting with the baby, if the baby is in the room with the mom, to make sure there's adequate bonding. And I'm also going to ask, how are you feeling today? I'm going to make sure I assess her emotional state, because postpartum blues is common for all women. All right, I am here to do a head-to-toe assessment just to make sure that everything's looking normal after having your baby. Is that okay with you? Perfect. If you have any questions, just let me know. Some parts of this exam are a little bit invasive, and some can be a little uncomfortable. So if you do start feeling any significant amounts of pain, or you're starting to feel uncomfortable with something, just let me know and we'll stop. So I'm going to do my hand hygiene. There's hand sanitizer in here. Do my hand hygiene. Put on my gloves. First thing I'm going to do is I'm going to take your vital signs. I don't have a blood pressure cup in here, but when I would take the blood pressure, I want to make sure it's consistent with your blood pressure in the first trimester. Since we're dealing with healthy postpartum women with no real complications, it should be below 120/80 preferably. I'm going to count her respirations. They should be between 12 and 20. And I'm going to take her apical pulse and listen to her heart while I'm doing so for a full minute. All right, her heart rate should be between 60 and 100, though it is not uncommon for postpartum women to be in some pain. So if it is a little bit higher, I'll make sure to note it, but that is common. I'm going to take her temperature also. It should be between 97.6 and around there, between 99.4 also. Just the same. If she does have a fever, I need to let the provider know. This can be one of the postpartum warning signs. So all of your vitals are normal. The next thing I'm going to do is a breast exam. You're going to feel the back of my hand on your breast. I'm looking for any nipple trauma. I'm looking for how full your breasts are, the appearance and characteristics of your nipple, and I'm also looking for any colostrum, which is just the super fatty milk your body's going to be producing for the first couple days. So I'm going to pull up your gown. Is that okay? All right. I'm going to pull it up a little bit. All right. So when I'm assessing breast tissue, I'm looking for any trauma, any bruising. If there is bruising, it can be indicative that the baby hasn't latched properly. So if there is some bruising, I'll tell the mom. I'll tell the mother the next time you decide to breastfeed baby, give me a call, turn on your call light, and I'll come assist you. I'm going to be assessing the appearance of the nipple, if it's inverted, everted, or flat. I'm looking for any singular red spots, which could be indicative of mastitis. All right, you're going to feel the back of my hand. I'm assessing the fullness of the breast. It is completely normal for mom to have one breast that's maybe a little droopier than the other side. That is completely normal. And I'm going to assess for colostrum by squeezing just a little bit. All right. I'm also checking for any warmth, any abnormal discharge. Everything looks normal. The next thing I'm going to go to is assessing the uterus. I am going to pull your blankets down all the way. Is that okay? So while I'm doing this and doing a fundal exam, I'm also going to be assessing the lochia. So I'm going to have one hand under the symphysis pubis, and the other one's going to be pushing, since let's say she's 1 day postpartum, the fundus should be about 1 centimeter below the level of the umbilicus, or 1 finger breadth away. I'm going to gently massage and feel. I want the fundus to be firm. If it's not firm, if it takes some massage, or if it's a little boggy, I need to keep massaging until it becomes firm. Otherwise, the woman is at a very high risk for bleeding out. If it is off to the right, that can be indicative of the bladder being full. So I want to make sure I ask her, when was the last time you went to the bathroom? An hour ago? Oh, that's perfect. We want to make sure she's voiding every 1 to 2 hours. For postpartum women, it can be really hard to discern whether or not you have to go to the bathroom because of either an epidural or a C-section. So the fundal exam, I want to note the characteristics of it, so whether it's firm, soft, or boggy. I want to make sure I assess the location and the fundal height. So while I'm pressing on the fundus or massaging it, I want to be inspecting the lochia. Since she is 1 day postpartum, there will be bright red rubra lochia for the first couple days, for the first 72 hours or so. There should be no blood clots bigger than the size of an egg, and she shouldn't be filling up more than 1 pad an hour. Less than that, it's another postpartum warning sign. She could be bleeding out. And then I'm going to ask her, when was the last time you changed your pad? Perfect. And when you change your pad, were there any blood clots you noticed? No, that's good. Blood clots are completely normal. You just want to make sure if you see one bigger than about the size of an egg, you let us know. So next I'm going to be moving down to the bowels. I'm going to inspect the abdomen. I want to listen to bowel tones before I start pushing on anything. Make sure they're present in all 4 quadrants. I'm going to ask, when was the last time you had a bowel movement? It is completely normal for postpartum women to not have a bowel movement 1 to 3 days after giving birth. It can take up to 9 days for your GI motility to get back to where it was before you were pregnant. That's completely normal. I also want to inspect for any bowel distension, which can be indicative of severe constipation. And I don't feel any. Everything is looking normal. Then I move down a little bit more. If she did have a C-section, I want to make sure I check her urine output. There should be more than 30 milliliters per hour. I want to inspect the incision. Per hospital policy, I may be able to remove the dressing or not. If I'm not able to, I'll just inspect the dressing itself, make sure it's labeled correctly, make sure it's not coming up, make sure there's no redness, tenderness around the dressing. I want to know any signs of infection I see, if it's particularly warm. If I can peek under the dressing and look at the incision, I want to make sure the edges are nicely approximated, that there's no strange discharge, no odor. With the lochia, I'm also looking for odor. Just don't want any weird smells. And looking for any signs of infection with the C-section incision. Moving down to the bladder. Again, if the bladder is completely full, the uterus may be pushed off to the right. That is normal, and we want to make sure mama gets up to void either at that part of the exam or before the exam even starts. We want to feel around for any bladder distension, and again, making sure she's peeing at least 30 milliliters each hour, whether she had a Foley catheter put in or is able to get up and go to the bathroom every 1 to 2 hours. So moving down, I'm going to hopefully move this. There we go. And I'm going to inspect the perineal area. I'm looking for reta, so any redness, ecchymosis, or bruising, edema, discharge, and I'm looking for the approximation. If she did have an episiotomy, I want to make sure I inspect the incision, make sure the edges are nicely approximated, there's no redness, no discharge, and no weird smells. I am also inspecting the anus for any hemorrhoids. She does not have any. Hemorrhoids are very common for women postpartum. And again, looking for any discharge, any redness, tenderness, swelling, anything of that nature. All right, I'm gonna go ahead and pull your gown down. It is completely normal for women postpartum to be peeing a lot and to be very, very sweaty or diaphoretic. If you, it's completely normal for you to sweat through multiple gowns in a day. It's completely normal if you need some help getting up or changing, just give me a call. Next, I'm going to inspect the legs. I'm looking for any redness, any swelling. Some edema is normal in postpartum women and pregnant women. So I should note whether it's 1+, 2+. I'm also looking for any redness, swelling, tenderness, or warmth in the legs, which could be indicative of a deep vein thrombosis. I'm going to test for Homan sign, which is I'm going to lift your leg up, just relax it into my hand, and I'm going to push your foot back. I'm going to dorsiflex the foot. Do you have any pain or tenderness in your calf? No, that's perfect. I'm also looking for any signs of clonus in women who may have had eclampsia. I'm going to do the same with the other leg, or preeclampsia. Dorsiflex the foot. There should be no pain or tenderness in the calf. If there is, she needs to let me know. And again, no clonus in this foot because it can be indicative of a blood clot. I'm also going to check cap refill in both feet, which there it should be less than 3 seconds. And I'm going to assess the deep tendon reflex of the knees. She should have a deep tendon reflex in both knees. Perfect. The last thing I'm going to do is assess her hands. Make sure she has a cap refill in her hands also. One thing I didn't do, reset the moment, I would also take a pedal pulse in both the feet. Just make sure there's adequate perfusion. Alrighty. I believe I am all finished. Do you have any questions for me? No? Perfect. I'm going to teach you about some more postpartum warning signs. So if you see any of these, you need to turn on your call light and let either the nurse or the doctor know. So if you have any chest pain, shortness of breath, if you experience a seizure, any thoughts of harming yourself or your baby, if you are bleeding, again filling up a pad, more than one pad in less than an hour, or have blood clots the size of an egg or bigger, let us know. Is the incision if she has a cesarean section or an episiotomy. If there is any signs of infection or the wound is not healing, you need to let us know. Or if you notice any redness, tenderness, or pain in your lower extremities, in your legs, especially the back of your legs or your feet, let us know. If you have a temperature higher than 100.4, let us know. And if you experience a headache or some vision loss that's not fixed by some Tylenol, you need to let us know. But that's everything I have for you. If you need anything, let me know. Do you have any questions?
I'm going to teach her about C-section education.
All right, so if you, you've opted to have a C-section, so make sure that you are not lifting any more than your baby plus, well, any more than your baby, really. You want to make sure that you are not overexerting yourself, that you're taking good care of that incision. Something you can do is take a sitz bath that helps clean everything up and prevent infection. In your baby, you will notice that he may be breathing a little faster than normal. That's completely normal. For babies to be tachypnic after a C-section birth and to have some periods of apnea, so they breathe really fast and then they stop for a few seconds and they start breathing really fast again. That is completely normal while your baby's just trying to get some of the fluid out from their lungs or absorbed through their lungs. Make sure that you are keeping the dressing intact for however long the doctor says. If he takes the dressing off, make sure you're checking your incision for any redness, if it starts smelling weird, if there's any discharge from it, or if the edges are starting to pull apart, let us know. And again, make sure, since you are 1 day postpartum, you should be getting your Foley catheter out here in a little while. Make sure you continue to set a schedule for yourself. Once the Foley is out, pee every 1 to 2 hours. The bladder is the last thing that the anesthesia wears off from, so it can be really hard to tell when you have to pee. If you notice that your constipation is going on longer than 3 days, call your provider. When I was listening for Partum, they were present in all 4 quadrants, so that is what we want to see. But if you're not pooping within the first 3 days, you need to give us a call. And I think that's it.